someone has fibroids, then we have to really have that conversation about what do we do about them and do we have to do anything about them? First of all, again, I'll keep repeating, millions of us have them and they are asymptomatic regardless of size. We have patients with very large fibroids who absolutely, after a careful discussion where I really want them to understand that they can tell me if they're uncomfortable, they swear up and down they're not uncomfortable, and then they don't need anything done. Other women with even smaller ones, depending on where they are, for example, if they're inside the cavity of the uterus, meaning the part where the lining thickens and sheds when you have a period every month, if they're inside there, they might cause really profoundly heavy bleeding that people do not need to suffer through. So luckily, there's a bunch of different ways we can treat. We can use just traditional hormonal contraception, meaning the birth control pill, patch, or ring can be used to treat it. We can use hormonal IUDs that have progesterone in them, and that goes into the uterine lining and makes the lining thinner so that the bleeding is much less. We can use an injectable medication that really antagonizes the hormones, and that's actually in many ways the most effective, but it comes with side effects because it is shutting down your hormones to help shrink the fibroid. And then we have an oral version of that medication that seems to have fewer side effects. So there are more and more medical options on the horizon outside of even surgery that we haven't yet discussed.